This is a short demonstration to show the actions caused by the upper limb, starting with the distal interphalangeal joint. At the distal interphalangeal joint, this is the flexion of the distal interphalangeal joint, and this is the extension of the distal interphalangeal joint. The action caused at the proximal interphalangeal joint is the flexion, and this is the extension. The flexion at the distal interphalangeal joint is done by the flexor digitorum profundus. The action that the flexion at the proximal interphalangeal joint is caused by the muscle flexor digitorum superficialis. The extension caused at the distal interphalangeal joint, the muscle involves the extensor digitorum The extension in the dorsal part of the hand is primarily caused by extensor digitorum. Extra extensors are given to the index finger and the little finger, the distal interphalangeal joint and the proximal interphalangeal joint. The tendon splits into the middle slip and two collateral slips. The middle slip inserts into the base of the middle phalanx, and the collateral slips join together and insert into the base of the distal phalanx. The muscles that insert into the extensor expansion are the lumbricals, the dorsal interosseous and the palmar interosseous muscles that together cause the extension of the digits. This is the metacarpophalangeal joint. This is the flexion at the metacarpophalangeal joint, and this is the extension at the metacarpophalangeal joint. Going with the actions caused in the thumb is the flexion of the interphalangeal joint and the extension of the interphalangeal joint. The actions caused at the metacarpophalangeal joint of the thumb include the flexion of the thumb, the extension of the thumb, the abduction of the thumb, and the adduction of the thumb. The opposition of thumbs. The flexion of the thumb is done by the flexor pollicis brevis and the flexor pollicis longus. The extension of the thumb is done by extensor pollicis brevis and extensor pollicis longus. Abduction of the thumb is caused by the abductor pollicis brevis and the abductor pollicis longus. The action of opposition by the thumb is done by the opponent's pollicis, and the adduction of the thumb is done by the adductor pollicis. This is the abduction of the digits, and this is the adduction of the digits. The dorsal interosseous muscles cause the abduction of the fingers, while the palmar interosseous muscles cause the adduction of the fingers. The flexor digiti minimi causes the flexion of the little finger. The abductor digiti minimi causes the abduction of the little finger, and the opponent's digiti minimi causes the opposition. Opponent's digiti minimi causes the opposition of the little finger, as in cupping of the hand. Actions at the wrist joint include the flexion of the wrist, the extension of the wrist, the adduction of the wrist, also known as the ulnar deviation, the abduction of the wrist, also known as radial deviation. The secondary flexion is done by flexor digitorum superficialis and the flexor digitorum profundus. Primarily, the extension at the wrist joint is done by extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. Secondarily, the extension is also assisted by the extensor digitorum, extensor digiti minimi, and extensor indicis. Brachioradialis assists in the flexion at the mid-prone position. The abduction at wrist joint is done by flexor carpi radialis, extensor carpi radialis longus, and extensor carpi radialis brevis. The adduction of the hand is assisted by the extensor carpi ulnaris and the flexor carpi ulnaris. This is also known as the ulnar deviation.
Demonstration of the supination movement in the body. In the anatomical position of the body, the hand is supinated. This is a demonstration of the pronation movement in the body. This is the movement of the hand from pronated position to supinated position. The joints involved in the supination movement is the superior radio-ulnar joint, inferior radio-ulnar joint, and the intermediate radio-ulnar joint, that is also called as the interosseous joint. The axis of the movement includes the vertical axis passing through the head of radius and the styloid process of ulna, that is the lower end of ulna. The muscles involved in the pronation movement include the pronator teres and the pronator quadratus. The pronator teres originates from the medial epicondyle of the humerus and inserts into the middle of the lateral aspect of shaft of radius. The nerve supply of pronator teres is the median nerve, and the actions include the pronation of the forearm. Quadratus originates as an oblique ridge on the lower 1/4 of the anterior surface of the shaft of ulna and the area medial to it. It inserts as the superficial fibers into the lower 1/4 of the anterior surface and the anterior border of the radius. The deep fibers into the triangular area above the ulnar notch. The supply of the pronator quadratus is the anterior interosseous nerve, and the actions include superficial fibers pronate the forearm and the deep fibers bind the lower ends of radius and ulna. These are the muscles of the supination movement, the supinator and the bicep fiber. The origin of the supinator includes the lateral epicondyle of humerus, annular ligament of superior radio-ulnar joint, supinator crest of ulna, and depression anterior to it. It inserts into the neck and whole shaft of upper 1/3 of radius. The nerve supply of supinator includes the deep branch of radial nerve, also known as the posterior interosseous nerve, and the actions include supination of forearm when elbow is extended. A fact about the posterior interosseous nerve is that it enters into the back of forearm by piercing into the supination. The range of supination. In the flexed elbow, the forearm can be supinated from 140 to 150 degrees. In an extended elbow, it can be supinated to a total of 360 degrees. This is a demonstration for the movements at the elbow joint. This is the flexion of the elbow joint. This is the extension of the elbow joint. Supination of the elbow joint. Pronation of the elbow joint. This is the flexion at the elbow joint in the mid-prone position. The brachialis is responsible for the flexion of the arm, and the biceps brachii is responsible for the flexion in the mid-flexed forearm. It is a strong supinator and also performs the screwing action in the semi-flexed arm. This brachii has two heads of origin. The short head arises from the coracobrachialis from the tip of the coracoid process. The long head arises from the supraglenoid tubercle of the scapula from the glenoid labrum. The tendon is intracapsular. It inserts in the following manner. The posterior rough part of the radial tuberosity. The tendon is twisted. The anterior fibers become lateral and posterior fibers become medial. The tendon is separated from the anterior part of the tuberosity by a muscle. The tendon gives off an extension called bicipital aponeurosis, which extends to the ulna and separates medial cubital vein from the brachial artery. The nerve supply of the biceps brachii includes a musculocutaneous nerve having the root value C5 and C6. The action of biceps brachii include: it is a strong supinator when the forearm is flexed. All the screwing movements are done with it. The extension of the elbow joint is done by the triceps brachii. This is a demonstration of the movements at the shoulder joint. This is the demonstration of the movement extension, flexion at the shoulder joint, abduction at the shoulder joint, adduction of the shoulder joint, lateral rotation at the shoulder joint, medial rotation at the shoulder joint.